I'm Rob Aldridge. I'm based at University College London and I'm a public health clinician. I did my junior doctor's jobs in an accident and emergency department and I worked on a cancer ward. And I found it really frustrating dealing with the consequences of disease. And public health is all about preventing that and doing things to stop people from going to hospital and getting unwell in the first place. And that was really my motivation, was what can I do in my career in terms of stopping people from becoming unwell in the first place? And that's the ultimate aim. We don't obviously always manage it, but that's what we're hoping to do within public health. So we look at the surveillance data, so we're looking continuously at diseases like tuberculosis, my area of research, flu, meningitis, pneumococcal disease, those sorts of disease, and understanding whether there's an increase, and if there is an increase in that, what can we do about it? How can we stop other people getting infected? But that's the kind of less reactive, immediate type work. That's the kind of sitting in front of the computer, counting cases. We're now seeing a resurgence of TB. London has got this dubious title of being the TB capital of Europe, and we're really seeing an increase in the number of cases over the last 10 years. The focus of my research is looking at TB in people not born in the UK, and we get double the number of cases in this population, but it's actually 18 times the rates in this population. And really what I'm trying to understand is how we can tackle this, how we can improve the health of this group and make sure that they don't get unwell, and if they do get unwell, finding them early and giving them good treatment. The focus of the research that I've been presenting today is partly looking at individuals, whether they've got TB at the time they come into the country. So from 2005, the UK government introduced a screening program that looked for TB before a migrant came to this country. And if they had TB, if they were detected with TB at that point in the visa application process, they weren't actually allowed to come into the country. But actually that's interesting from a public health point of view, but really what I've been looking at is those people that didn't have TB when they were being screened initially, what happened to them afterwards, and did they then go on to develop TB? And it's really untangling this kind of long period of infection. So when someone has TB infection, they're not aware of the symptoms, but they can progress and go on to get the active symptoms in their lungs and spread it onto other individuals. And the research that I've been doing is looking at this situation, how much of it there is and how much of it we could prevent by adding in additional tests. In summary, what we found is that migrants do have an increased personal risk of tuberculosis, but importantly, if we were to add in a new test screening them for latent infection and were to treat them for that, we could actually prevent a lot of disease in this population and reduce that personal risk. Interestingly, and I think one of the really important public messages from our research is that we found that whilst the individual risk of tuberculosis to a migrant is very high, they have very, very low rates of spreading the disease. So they're not spreading disease to the population in the UK. There's very few cases. We detected 1,873 cases of TB in this group, but there were only 35 of them that were spreading disease, so a very small number of them. What I'd really like to do, the methods that I've developed are applicable to other diseases. So the methods that I've developed are now enable us to track people across countries and across populations. And really the groups that happen like this, migrants, homeless populations, drug users, sex workers, at the moment, they're invisible to policymakers and to politicians because we can't track them. We can't say how much disease they have in this population. And really, the focus of where I'm trying to take these methods and this research is making these invisible populations visible so that they cannot be ignored and so that we can improve their health through various public health initiatives.